So how long does it take and how much does it cost? Well, there's two main studies that you need to know. On a scale of 0 to 100% function, research shows that you have to be down to 60% function before you start to feel symptoms. So that means if you're in here right now, headaches, low back pain, numbs and tingles in your fingers, your blood pressure is high, cholesterol's high, that you're functioning somewhere in the 60% function zone. Not good. There's another research article that shows that only 6% of your nerves control pain. So as a chiropractor, you got to realize I only have to get you 66% function before you feel better. And that is where the traditional chiropractic pain model comes in. You come in with back pain, you get adjusted, you feel better. Headaches, back pain, and you're just doing this yo-yo pain symptom chasing for 15, 20 years, but your spine is still messed up and you're really never feeling well. Well, what we do in a corrective office is a lot like braces. So with braces, there's three phases. There's the corrective phase, the stabilization phase, and the wellness phase that we call a retainer. In the corrective phase, we're putting metal on our teeth, we're taking crooked teeth and we're making them straight. It's really maximally moving the gums. It can be a little bit painful. You got to go to the office more often. Then there's the stabilization phase where the teeth are pretty straight, but you can't take the braces off or they will immediately move back. You're waiting on the soft tissue to stabilize to hold the teeth there. And then finally you get into the retainer phase. Now there is no point in getting braces if you're not going to wear your retainer. Would you agree? Because if you don't wear that retainer, your teeth are going to shift right back to the way they were in 3rd grade and the whole thing was a waste. Chiropractic is the same exact way. In the corrective phase, we're getting adjusted 2 to 3 times per week for a month or 2, right? And that is where we're really moving the bones. It's the most work, but it's also the most result. That's where you get your symptoms to move quickly, but we can't be done there. We go to the stabilization phase, where we're getting adjusted 1 to 2 times a week for a month or 2, and we're letting the soft tissues really mold and keep your spine in the right position. And then finally, we get to the wellness phase. Getting adjusted wellness phase once a week, once every other week. And that is really just keeping your spine where it's supposed to be, because every day you're beating it up and it's always trying to go back to the way that it was. Now, there's 2 types of corrective plans that we have in the office. We have a standard corrective plan, and that's going to be your normal everyday whiplashes, symptoms. You're not dying when you come into the office and we're just ready to get corrected. And then we also offer an intensive plan. Some people are coming in and you're just kind of done, right? You have been in a lot of whiplash, you have a lot of pain, your discs blown out in your back. Maybe you have really active symptoms. Your blood pressure is through the roof. Maybe you're fighting cancer, and we really need to attack your spine a lot more now. The beautiful part is the only difference between these plans is the frequency. So in the intensive plan, we do a little more adjustments, a little bit more often in the beginning than we do in this standard plan. All right, Dr. Ben, with all these adjustments, how much is it going to cost? Well, the reality is that we've got flexible care plans, and it's way less than you think. So the number one question we get is, does my insurance pay for corrective chiropractic? And unfortunately, the answer is no. If we went through your insurance, that would cost substantially more. Our corrective adjustments are $65 a piece, which is actually really affordable. But when you put a $65 adjustment with $50 therapies. Now we have x-rays, reevaluations for hundreds of dollars. I mean, you'd be well into the $8,000 to $10,000 for a care plan if we did insurance. The reality is that your health is the most valuable thing that you have on this planet. If you're standing in the kitchen, your husband dropped dead of a widowmaker heart attack, or the door opens and your kid comes home from school with bruises on his leg and gets diagnosed with acute leukemia, you would spend any amount of money to reverse that, to bring them back to life, because your health is so valuable. Unfortunately, in the United States, particularly, we don't value our health until when? Until it's gone, until we have a heart attack or we get a diagnosis. Then we start taking our health seriously. And I'm going to encourage you to invest in your health. Most people that are watching this are spending more money insuring their car that they're not going to own or value in 10 years than you do on your own health. And the reality is 10 years from now, your health is going to be more valuable to it. Some of you are going to get married, you're going to have kids, you're going to have grandkids, you're going to finally get retired, so you have a little bit of time to go enjoy what you've been working for, and you're going to find out real quickly whether you've invested in your health and you're good, or you didn't and you get an expensive, horrible diagnosis. And we just want to be on the side of helping you. So when it comes to money, we have flexible care plans, whether you're on an intensive care plan or a standard care plan. We're going to make sure that you and your entire family can get care here. The opposite of being lost isn't being found. The opposite of being lost is knowing where you're at. So what's going to happen here in a minute is a doctor or tech's going to come in the room, we're going to go over your x-rays, and for the first time we're going to get to see where you're at. How's your body functioning? How's your body healing? Are you developing arthritis? Are you developing disease? Or is your body running normally? We're going to see that, and then we're going to go over a corrective plan with you. Now there's a really important question we're going to ask you when we get done, and that is on a scale of 1 to 10, how committed are you to getting your spine corrected? Because the reality is this is your work. If you're not committed, if this isn't for you, it's okay. Just let us know. We'll love you. We'll hug you. We'll send you down the road. But if this is for you, we're going to be on team together. We're going to work really hard, and this is going to be your healthiest year. Guys, I'm Dr. Ben, and I cannot wait to hear your miracle story.